Hello everyone, my name is Zhang Yunke from Tsinghua University. It is my pleasure to share our work Passive Health Monitoring using large-scale mobility data that I did with Dr. Fengli, Dr. Tong, Professor Vassilis Kostakos, Professor Ban, and Professor Yong. I will introduce our work in 4 parts. Before we go into the detail of our methods, I will first introduce the background and research problems. People's interest in health monitoring has consistently grown in past years. Currently, more than half of mobile phone users track their personal health status with health applications. However, traditional health monitoring methods like questionnaire and custom-designed hardware are difficult to implement at large scale due to intensive human labor and high expense. Alternatively, mobility data offers a novel opportunity for passive health status monitoring. It has the advantage of passively collecting, as well as providing a proxy to measure the level of physical activities and interactions with various locations, which has been proven informative to infer health status. These advantages inspire us to investigate the feasibility of using mobility data to monitor health status. Specifically, we want to explore the correlations between mobility data and users' health status, and design a predictive model for large-scale health monitoring. Challenges on the experiments are the collection of appropriate mobility data source for health status monitoring and unclear mechanisms of mobility's influence on health status. To address the challenges, we propose 3 key designs in this research. First, we collect a large-scale mobility dataset with high spatial-temporal resolution. Then, we propose various health-related features extracted from mobility trace records. Third, we predict health status with these features and analyze how they influence health prediction. Collecting an appropriate data source for health status monitoring is essential. Here, we collect the mobility trace record data of 2,112 users, as well as their health status and demographic information. Half of the users are outpatients of Beijing's major hospitals. Others report good health status. They authorized us to collect up to 2 months of mobility trace records that capture their visits across the metropolitan area of Beijing. More information on demographic features are shown in the table. To demonstrate users' interaction with urban space, we adopt Beijing's point of interest dataset. This dataset contains more than 1 million POIs with geographic location and categorical information. After we obtain users' mobility trace and health status, we need to extract well-defined and meaningful features from mobility traces to understand the relationship between mobility and health. We design following features to characterize health-related patterns. First, the radius of gyration depicts users' vigor of mobility. The standard deviation of displacements characterizes the regularity of mobility. The distribution entropy of locations visited captures the diversity of movements. The above features are regarded as mobility features. Then, we characterize users' neighborhood environment features by counting the health-related POIs and green space area around their home. We consider POIs in food, entertainment, scenic spots, and sports categories, and fast food store and tobacco liquor shop subcategories. Finally, the places where users visit can also reveal their health status. We calculate the POI environment around each visited location and take the average as users' visitation environment features. To study the feasibility of using mobility features to predict hospital visits, we train a binary XGBoost classifier to predict users' health status with demographic and mobility trace features. We report the AUC and F1 score of using different feature combinations as the classifier's input. To interpret feature importance in the prediction model, we adopt the analysis framework of Shapley values. It measures features' additive importance for a particular prediction. Features with positive Shapley values in a prediction leads to a higher probability of predicting the user to be unhealthy. From the results of prediction performance, we can first recognize that prediction with all features as input has the best performance, and it is significantly higher than using only demographic features as input. In addition, comparing the first and the fifth row reveals that the combination of mobility trace features outperforms the prediction made with demographic features. These findings provide strong evidence that it is possible to use mobility trace data to monitor health status. Here we show the results of feature importance analysis. Red bar in the right figure means that higher feature value correlates with higher possibility of predicting unhealthy, where blue bar is correlated with healthy. First, age, the standard deviation of displacements, income, and entertainment category POI density around visited points are most important 4 features. Then, from the color bars, we can interpret that users are more likely to be predicted as healthy if they have a higher coverage area of movements, more diversity in visit pattern, more scenic sites, sports facilities, less tobacco store and entertainment venues in neighborhood, more visits to sports and scenic sites, and less visits to entertainment venues. To conclude, we investigate the correlations between large-scale passively collected mobility dataset and overall health status. We extract features from mobility traces that can significantly enhance the performance of health status prediction. We provide deeper insights into how mobility features affect the health status prediction by feature importance analysis. These findings offer implications on real-time, large-scale overall health monitoring. Thank you all for your attention, and I am glad to take any questions.